Okay, so now we are back after ablating the second smaller lesion, and once again we have a quick scan to check through both sides, and there is a little bit of sagittal movement on the coronal plane, but not a lot, and probably the fact that we've already done an ablation in that area is having an impact as well, but I think acceptable. And so when we go back to our original lesion, we thought it was this smaller component up here, and we have a quick look manually. It looks quite good manually, but we will go to the AblaSure technology to have a look, and we shall see what this will tell us. And it's telling us that it's a good set of numbers there. It's 100% lesion coverage and 99% margin coverage. So we seem quite happy with that one. And when we go, usually what we tend to do is we tend to go to the these images and rotate through, and they tend to give you a good idea of where you think you may have missed or where you may be close. And looking at this one, the closest point of the ablation zone is right here towards the edge of the liver, which is a feature that has been picked up in the latest version of AblaSure with whole organ, with segmentation, and to take that, to factor in the fact that you're at the edge of the organ. But overall, I think we're very happy with that. I think that is perfectly acceptable. We will now go back to our first lesion. So on the original scan, we had an 84% lesion coverage and a 70% margin coverage. And then when we go back again and look at where we think we are missing, interestingly, what we are seeing is a hyperemic rim around the edge of the margin has been included there. And so we can see what has been segmented in the ablation zone is not covering the tumor, but the question is whether that segmentation is truly the full representation of the ablation zone. What you can see is this subtle high attenuation area, which there's obviously a vessel here, but the question is whether this is part of the ablation cavity. Okay, so I think we should do a small repeat burn targeting this area here. We'll go into the re-ablate workflow using this scan. And now what we will see so there was our original tumor, and that is where we think we are perhaps slightly short on it, is in this section here. So within this, I think we ought to target in and around the lateral aspect of that ablation cavity. And I think that's probably what we will be looking to do. So we will re-zero. So here we see it, it's hypo attenuating on the portal phase CT. We will do automated segmentation of this lesion, and we can see that the segmentation has worked very nicely. We're going to aim to increase the ablation margin to 1 centimeter, and we will also see here that what we've used is the smart margin facility, where the bottom aspect of the or the sort of posterior aspect of the tumor the margin was overlying the fat and perihepatic soft tissues, but using the smart margin, that is then aligned with the edge of the liver. So we can see that 150 at 1 minute 30 would probably cover the tumor, but not maybe the margin. So we'll expand that with the imprint probe. We'll go to 230, we'll go a bit higher. 3, we'll go a bit higher. 4. And again, I think 4 looks like we'll have good coverage of the tumor and of the margin in addition. So place. What we're seeing is a result where the numbers initially show us that we've got 81% lesion coverage and 63% margin coverage. Now, when we look at this scan, what we will see, if we focus on this left-hand screen, is that we will see that there has been some movement in between. So when we look at the original scan, which is here, we can see that the safety margin, the smart margin, has gone right up to the edge of the liver as we'd expect it to. And when we look at the tumor margin, this is the post-ablation scan, we can once again see that the ablation margin has also gone right up to the liver, but it doesn't quite overlap the yellow safety margin, and that is to do with motion in between those two scans. Nevertheless, I'm satisfied with this because the margin that has been segmented of the ablation zone extends to the liver, edge of the liver, and therefore I'm confident that despite the overall number that's been given, that we've covered this tumor satisfactorily, and we should not expect a local recurrence at this site. So in this scenario, we also have the option now to do a manual fusion of the two scans to account for the slight respiratory variation. And it's also, I would expect that should we do that, we would see a number that is closer to 100% coverage than what we've seen initially.